So my name is Caitlin Rogers. I'm the Unhoused Services Data Coordinator with Neighbor Impact, and I use she, her pronouns. The Homeless Leadership Coalition is the governing body for Crook, Deschutes, Jefferson counties and the Confederated Tribes of Warm Springs, and is responsible for the coordination and execution of the point in time count, which is why all of you are here to kind of hear what those results look like and what changes we saw from last year to this year. So a little bit about the HLC, like I said, governing body for the Tri-County area, as well as the Confederated Tribes of Warm Springs. They work to prevent and end homelessness across the region using a cross-system collaboration and coordination with service providers and local governments. And our goal of the HLC is to prevent homelessness, also while making homelessness rare, brief, and non-reoccurring. So for all of you, the point in time count, I will most likely be referring to it as the PIT count. It is a HUD, Housing and Urban Development mandated, I would say, exercise. It is nationwide, and it essentially is a census count of everybody experiencing homelessness on a single night, typically within the last 10 days of January. It helps us monitor the number of people experiencing homelessness, what those demographics look like, some potential causes, how people are accessing resources or may not be accessing resources. And it also helps us really just see the needs of our community members. So for this year, we conducted the point in time count on January 24th and used the following days until January 31st to ask individuals where they slept on Tuesday, January 24th. We utilized a variety of service providers who are already working with the unhoused population to complete unsheltered surveys and do unsheltered observational surveys for when people were not able to complete the full survey. We also did a service lease count where we utilized all of our HMIS data for our shelters across the region. And so for this year, we saw a total of 1,647 people experiencing homelessness in Central Oregon, so the Tri-County region, as well as Warm Springs. We were able to collect 708 unsheltered interview surveys, 481 unsheltered observational surveys, so when somebody either declined or they weren't able to survey. And then we completed 483 sheltered surveys through our HMIS data and some additional surveys that are not a part of the HMIS system at the moment, which is the Homeless Management Information System. And these surveys were conducted across the Tri-County region, so Lapine, Sisters Bend, Redmond, Madras, Prineville, and on the Confederated Tribes of Warm Springs Reservation. And one thing to note about the point in time count and really these surveys and all the data that we do collect, the point in time count is really just a snapshot of the overall homeless population. With the shelters, we're pretty confident that we capture everybody who accesses the shelter the night of the point in time count, but people do have the option who are living unsheltered to decline the surveys. So some of the unsheltered surveys, we don't have full surveys completed. People are volunteering to provide information about themselves. And we know that we have a pretty large service area, geographically speaking, and so that does not allow our service providers, specifically our outreach providers, to be able to get to every single person who is living unsheltered within the region during that week. So we know it is just a snapshot. It is not 100% the full picture, but we feel pretty confident with the efforts that we put forward this year that it is the most accurate picture that we've ever had for point in time in the past. So With it being a snapshot, some people might ask, why is the point in time count even important? It is one of the main sources of data that is utilized for us to be able to advocate for additional financial resources within the region. It really helps us to see the changes over time from year to year. Helps us monitor for racial disparities in services. And it's also really good to be able to compare against our by name list, which is generated through our HMIS services. And so it helps us look who is experiencing homelessness within the region, but may not be accessing services in HMIS. So that could be shelters, other street outreach, different things like that. And then we also ask some additional questions that are just for our community to know, to really understand what the needs of our neighbors experiencing homelessness are, and some potential solutions that we can be advocating and implementing. So for the point in time count, we have a pretty narrow definition of who experiencing homelessness is. So depending on what different surveys you look at or different publishings of data stats, you may see different numbers because the definition of who is homeless varies across different entities. So healthcare, schools, a variety of other community services do utilize a different definition of homeless than what Housing and Urban Development uses. So HUD uses a very specific definition, which is anybody who is living in an emergency shelter, a transitional housing program, or a hotel/motel that is paid for by a voucher or another service entity. So that could be somebody who has some medical needs that a shelter may not be able to care for. And so instead of turning them away from the shelter says, hey, we can actually put you up in a hotel for the next 2 nights instead. Additionally, for unsheltered, HUD has a pretty narrow definition as well, and that is somebody who is living in a place that is not meant for human habitation. So cars, RVs, camping, not having access. They could be in an RV, but maybe not have access to habitable conditions like heat, water facilities, things like that. We did, for the first time within our point in time count, intentionally collect information on what we would consider individuals who are living precariously. So we know that the point in time count doesn't capture that information, but for our community's sake, we really wanted to know how many people were experiencing doubled up situations, how many people on any given night may be staying in a hospital or a treatment facility where they were homeless when they entered the program, and they expect to be homeless when they exit the program as well. And with that, we had 279 surveys collected that don't fit into that really narrow definition of homelessness. According to HUD, that was just for our community's sake to understand more clearly. So with our point in time count, this is a breakdown of comparison of people experiencing homelessness by the city compared to 2022 and 2023. So we did see a pretty good increase in most communities. And part of that was last year, we did have a pretty big COVID wave that came through at the end of January. It prevented a lot of our providers being able to do as thorough and as accurate of unsheltered counts as we wanted to. And so part of that, we believe, led to an undercount last year. We still believe that in some communities we have an undercount, such as our more rural communities of Madras and Prineville, with just really scarce outreach efforts there, and outreach being spread as thinly as possible. And so we know that we have a little bit of an undercount, but we do feel like this paints a little bit more of an accurate picture in these communities. And then when we break it down by county and comparing it from 2022 data to 2023 data, we still see that Deschutes County has the majority of our homeless population residing in it, specifically the vast majority of our unsheltered population as well. Looking at the breakdown of all people experiencing homelessness on the night of January 24th, this is the breakdown of what those household makeups look like. So we have families who are any adult who has a minor child with them as well. That made up 10% of all households experiencing homelessness, both sheltered and unsheltered. Children-only households, which means that anybody that was under 18 who has been receiving services or living unsheltered without being accompanied by an adult, made up 2% of the household. Our youth is anybody who is between the ages of 18 and 24. You may also hear that be considered transitional age youth. They made up 12% of all households experiencing homelessness. Parenting youth, same age range, 18 to 24, but do have a minor child in their care, made up 1%. And then single adults, which is anybody over the age of 25 that did not have any minor child in their care, made up 75% of our homeless population. And so when we compare that to last year, we do see a little bit of a decline in families and a increase in single adults. Our parenting youth was just about the same. Our child only was just about the same. But we did see an increase in our transitional age youth households experiencing homelessness. Looking at just straight unsheltered counts and our sheltered counts, we did see an increase from last year, which is in blue, to this year, which is in orange, by roughly a little under 200 people for unsheltered homelessness. And the increase for the sheltered population has a lot to do with our ability as a region to expand shelter capacity from last year. Last year, we were still experiencing a lot of COVID. We were still having shelters having a lower capacity due to COVID regulations. And in July of last year was when we saw some of those regulations lighten, and where most of the regulations are now no longer in place. So we did see an increase in capacity of shelters, as well as a couple other new shelter opportunities. Specifically speaking to shelter, we do have some safe parking, but for the sake of the point in time count, HUD does not recognize safe parking as an emergency shelter. They would still consider it an unsheltered situation. So for the shelter, it is exclusively looking at emergency shelter and transitional housing programs only. And one thing that is pretty significant to note about our unsheltered versus our shelter population is that 73% of our population is experiencing unsheltered homelessness. We did see a little bit of a decrease from last year, about a 6% decrease. Last year we had a 3% decrease. We had 76% of people experiencing unsheltered homelessness, whereas this year, despite the population of unsheltered growing, we only see 73% experiencing unsheltered homelessness, which is still the vast majority and still a extremely high percentage of unsheltered to sheltered homelessness. One of the things we wanted to look at this year specifically was people living with disabilities and what that breakdown looks like between sheltered and unsheltered. Of people experiencing homelessness, 46% of the population has at least one disabling condition, and many of them have multiple disabling conditions. So we had 757 people have at least one disabling condition who are living unsheltered on the night of the point in time count, and 183 people with at least one disabling condition who are living sheltered. on the PID count night. And one of the areas that we also wanted to look at too was people who have serious mental illness and substance use disorders who are experiencing homelessness. And what we found from the self-reports in the point in time count were that 11% of people experiencing homelessness have a disabling serious mental illness, and then 8% of people have a disabling substance use disorder. And then with the chart here is a breakdown between who has either a serious mental illness, who is living unsheltered versus a substance use disorder, living unsheltered and sheltered. Oops, That is a duplicate, there we go. And so looking at our chronic homeless population, we found that 18% of all people experiencing homelessness experience chronic homelessness. And so what chronic homelessness is, it is a definition created by HUD, which means that people who are chronically homeless have experienced homelessness for at least a year or repeatedly, while struggling with a disabling condition, such as a serious mental illness, substance use disorder, physical disability, or a chronic health condition. And so for our unsheltered population in 2022, we had 108 people who were living unsheltered who were chronically homeless. In 2023, we saw 197 people living unsheltered. For our sheltered population, we saw 57 people last year experience chronic homelessness while being in an emergency shelter. And this year we saw 103 chronically homeless individuals. And part of the definition of chronic homelessness is that people do have to have long periods of homelessness. And so part of our increase that we believe in chronic homelessness is that people may have not been chronic last year, but may have been on the verge, who have now aged into it, that they've now spent long enough of a period of homelessness, or they've reached enough episodes of homelessness over a set amount of time to now be considered chronically homeless. So we did see a pretty big increase between last year to this year for those experiencing chronic homelessness. So some of the key findings about our chronic homeless population was that 50% of people living sheltered and chronically homeless were over the age of 50, while people who were living unsheltered, who were chronically homeless over the age of 50 made up 46% of the chronic population. Seniors who were 62 years or older made up 15% of the overall chronically homeless population, while only making up 5% of the overall homeless population. So our seniors who are experiencing homelessness are more likely to experience chronic homelessness. Part of that is as we age, we're more prone to having different illnesses, different disabling conditions, but also as you age, you are less likely to be able to increase income over time. And we're seeing a lot of seniors being priced out of our housing market. An additional thing to note was that 14% of all people experiencing chronic homelessness identified as Indigenous, Native American, or American Indian. And then when we compare that to our regional census, people who identify as Native American only make up 2% of Central Oregon. So we also see that our Native population is more likely to experience chronic homelessness as well. So when we look at our shelter versus unsheltered population, this is specifically for Deschutes County compared to this year to last year. So just kind of broken down in a different way just for you to be able to see Deschutes County. This is the population broken down for Crook County. And then here is our sheltered versus unsheltered population broken down for Jefferson County and the Confederated Tribes of Warm Springs. When looking at our population of people experiencing homelessness, we were able to break down the differences between our unsheltered population and sheltered population, specifically looking at age. We saw 268 people who were under the age of 25, so who would be considered children and youth, who were experiencing unsheltered homelessness on the night of the pit. And additionally, we saw 212 people over the age of 55 who were living unsheltered on the night of the pit. But we do also see that our 25 to 54 makes up the vast majority of our homeless population. One of the things that we do ask participants is the age at which they first experienced homelessness. And here is kind of the results of those responses. Not everybody responds to this question. And with our observational surveys, we obviously don't get to ask individuals these questions. But for those who did respond, this is the spread of ages and the percentages of people that fell into that age range for when they first experienced homelessness. And the average age of all people who did respond was 35 years of age was the first time they experienced homelessness. Breaking down our homeless population by race is really important to be able to see what racial disparities that we do have within our homeless population, and then also being able to see how that compares to the overall census of the region, and then also to be able to compare to see if we have any access issues for people accessing services. So where we can compare this to our HMIS data to see if it does line up or if we are seeing discrepancies of who is accessing services and who is getting permanent housing opportunities as well. So for our racial breakdown, we see that our multiple races, they make up 5% of our homeless population. So somebody who identifies as like a mixed race or more than one race. Somebody who identifies as American Indian or Alaska Native made up 10% of our homeless population. Asian or Asian American made up 1%. Our Black, African American, and African population made up 3%. Native Hawaiian and Pacific Islander made up 1%, and our white population made up 80%. And then also breaking it down by ethnicity as well, we see that 11% of our homeless population identifies as Hispanic or Latino, whereas 89% does not identify. And what we find with this when we compare it to our census data is that community members of color are more likely to experience homelessness than their white counterparts. And so we can break this down over here looking at the ASC census population totals for the Central Oregon region, which includes the Deschutes, Crook, Jefferson, and the Confederated Tribes of Warm Springs. And this can be found through HUD's racial equity analysis tool. We see that through census data, our Native population makes up 2% of the overall general population for the region, but yet make up 10% of our homeless population. Our Black population for the overall general public makes up 1% of our region, and yet makes up 3% of our homeless population. Same with people who identify as Hispanic. We see that for general population, our Hispanic population makes up 9%, and then they do make up 11% of our overall homeless population. Looking at homelessness by gender, we see that men are more likely to experience homelessness than women. That is a national trend that aligns with our area. The only exception is that we see in Jefferson County and the Confederated Tribes of Warm Springs that we did have a higher female population experiencing homelessness than male population. Part of our surveys is asking community members how long they have been in Central Oregon. And all of this is self-reported. And so with the self-reports, we found that 45% of people had been in the region for more than 20 years. So in the past, we had only asked up to 3 years, and we wanted to really see the true length of time people have spent in the area who are experiencing homelessness, because we didn't really feel like 3+ years painted an accurate picture. And we saw a lot of people identifying that they have been in the region for many, many years. And so length of time homeless, this question is asking somebody what their episode of homelessness, how long it has been consistent for. So the last time they were either in a permanent housing situation or a situation that would not match up with an unsheltered situation or an emergency sheltered situation. And so 80% of our homeless community who did respond to this had said that they had been homeless continuously for a year or longer. For our first time homeless population, we do ask if the episode of homelessness that somebody is experiencing, if it is their first homeless episode or their only homeless episode. When we found that 38% of people said yes, that this was their first or only episode of homelessness on the night of the point in time count. And this question was new for our region this year, was asking where people were living at the time that they became homeless for this episode. And what we found was that 77% of people who responded had said that they were living somewhere within Central Oregon, and 23% of people who responded said that when they became homeless this time, they were living outside of Central Oregon. So we also really want to see how our homeless population is accessing healthcare throughout the region. And so we really wanted to break down where people are getting access to medical care, and specifically looking at it by county, because that gives us a more clear picture of the resources that are available in that county and how they are being accessed. So we see that in Deschutes County, the majority of people who are experiencing homelessness were either accessing healthcare through the emergency room or through the Mosaic Mobile Clinic. 16% of them were accessing it through a regular doctor, a primary care physician throughout the county, or were accessing urgent care. And then we saw that only 2% access medical care through the VA medical clinic. In Jefferson County, the majority of people experiencing homelessness access healthcare through the Indian Health Services. And then the second most prevalent was accessing healthcare through the emergency room. Jefferson County, for their population, very few of them accessed healthcare through a primary care physician. In Crook County, most people were accessing healthcare through a primary care physician. Second was urgent care. 18% was Mosaic Medical Clinic, and then only 9% of Crook County was accessing healthcare through an emergency room. And so these were some self-reported causes of homelessness for participants who were willing to share about their experience of what led to them becoming homeless. So 29% had said either a combination of not enough money to afford housing, eviction, or foreclosure caused them to become homeless. 15% had said that unemployment or losing a job led to them becoming homeless. 14% said some sort of family or personal reasons led to their homelessness. 9% fell into an other, not fitting into any of these categories. 7% said that substance abuse led to their homelessness. And that one does differ from drugs and alcohol at home. So that was more of their personal substance use led to it. 5% said that they became homeless due to fleeing domestic violence, sexual abuse, or rape. 5% said it was due to a conflict at their property, so leading to an eviction that wasn't related to non-payment of rent. 5% said they became homeless because of others' use of drugs and alcohol within their home. 5% due to mental illness. 4% was due to physical illness, so like a chronic health condition or a developmental disability, and then 2% self-reported being a direct result of COVID-19. And again, these are only self-reports, so it's not going to be everybody's, not everybody that's surveyed is represented in this, because we do have a variety of people who do decline, but of the people who did answer, these were the self-reports that they provided. And so some of our key takeaways from this year is that overall, we saw a 28% increase in homelessness, both sheltered and unsheltered homelessness from 2022. And we saw 133 unaccompanied youth who were ages 18 to 24. We saw 1,297 adults who were 25 years of age or older. 196 children who are under the age of 18 were experiencing homelessness on the night of the point in time count. And then we saw 71 veterans experience homelessness on the night of the count who were included in the point in time survey. And so this is kind of some changes over time. We can see going back all the way to 2018 to 2023. One thing to note is that in 2020, we did a shelter count only. So it is a little bit of an anomaly in comparison to the rest of the years. But we do see an increase for the most part across the board, with the exception of households with at least one minor child. We saw a 7% decrease. And then children under the age of 18, we saw a 12% decrease in the total population. So some of the most notable ones are going to be our chronically homeless population. We did see an 86% increase from 2022 to 2023 for all households. And households is defined by a group of people receiving services together. So two single adults would still make up a household, and that's kind of why we differentiate between just like a single adult household and a household with at least one child. So we did see that the groups of people accessing services or living unsheltered did increase. That was a 41% increase. And we did see an increase in our veteran population. However, with being in coordination with COBO and them keeping a really accurate veteran by name list, we know that that number actually doesn't represent the veteran population. We know that it is a little bit under what the actual veteran population looks like because they are mandated by the VA to keep a veteran by name list of all veterans experiencing homelessness in the region. So veterans have been a harder one to accurately represent within the point in time count. However, we have seen within our region that veterans are, less veterans are experiencing homelessness now than in years prior because of the efforts put forward through agencies like COVO, the VA, and a variety of our service providers, which also fits and aligns with the national trend of declining veteran homelessness across the nation. One of the things that we did want to look at too was comparing our point in time count data to the Oregon homeless student data, which is publicly available and most recently published for the 2021 to 2022 school year. And so through agencies like Family Access Network and our McKinney-Vento liaisons, homeless student liaisons, they are collecting information on students and their living situations. And so we, in our point in time count, we collected 196 surveys that included children under the age of 18. However, when we look at the numbers of published on the homeless student data site through the state, our liaisons who are in the school districts are seeing that there are a higher number of students experiencing homelessness, as well as doubled up situations than what we are capturing in the point in time count. So that tells us that that there's a possibility that families are not accessing services for a variety of reasons. We may be capturing people who are parents in the point in time count who may not be disclosing that they have children. We did see a decline in our family homeless number, which doesn't align too much with what we're seeing in our coordinated entry system or within our homeless by name list, which is generated through HMIS. So families are always one of the areas that are harder to accurately count. But when we are able to layer it with an additional source of data, like the homeless student data through the state, we know that we have a lot more families that are maybe going in and out of homelessness or who are living in a doubled up situation who are not eligible for homeless services because they don't meet the homeless definition according to HUD. So here's a little bit about our precariously housed population that we did collect some data on. Again, these numbers don't match what we see through the state data, but this was just collected for the night of the PIT count. And this is specifically broken down by city of where people were living either doubled up, so living with another family, a family member, essentially not having their names on a lease, which puts both their own family and whoever is residing in that unit at risk of eviction for things like lease violations. So in Bend, we saw 30 households who were either living doubled up or paying and living in a hotel or motel and paying for it by themselves, which created 110 people in those households who were living in those situations. Redmond and Terrebonne, we saw 25 households, which hold 75 people in them. Lapine has 14 households and 35 people. Sisters, in the point in time count data, we saw that there was 2 households and a total of 8 people. Sun River had 2 households and a total of 11 people. That was a family of 2 bigger families. Madras had 2 households and 6 people total in those households. Prineville, 9 households and a total of 23 people in all of those households, which came out to 24 households for the Tri-County region, and 268 people who were living, specifically families, who were living in a doubled up situation or a hotel or motel that they were paying for. And then we had 11 additional surveys that were completed with people who were not families, so they didn't have a minor child in their care, who were living in a doubled up situation in a hotel or motel that they were paying for themselves, or a hospital or treatment facility where they entered that being homeless with the expectation that they will be homeless when they exit the hospital or a treatment facility. These surveys all, I think it's 279. These surveys are not included in any of the prior data that I went over and are not submitted to HUD for our formal PIT report, but was just solely for our community to understand the larger need of our region. So these were some additional metrics for the precariously housed, but that will be included in the slide deck. And so with this being only a snapshot, we always ask that question of, is the point in time count really accurate? And as the COC and with HUD, we do acknowledge that there are some flaws within the count. We see changes of counting methodology year to year. Like, for example, last year, we asked all shelters to complete surveys with their guests, as well as enter into HMIS of that data. And we actually saw at the end of that period was that we had less surveys that were actually created than people who were entered into HMIS. So this year we changed that methodology and we asked shelters just to ensure that all of their HMIS data was as accurate as possible and reflected who stayed there on the night of the PIT, which creates a lot more consistency with those surveys being completed and that number that we have. So we have changes in counting methodology year to year as we improve. It does allow us to kind of have a national comparison though, and that is really one of the benefits of the point in time count, because every continuum of care across the nation within the last 10 days of January is asking their population where they were sleeping on one of those days. So it does provide a really good platform of having a national comparison of what our community's population of homelessness looks like compared to others. It also allows us to compare our trends in the changing populations to the national trends and seeing if those align, if we are making more progress or if our efforts are not aligning with other efforts of other COCs. But we do still believe the point in time count to be a little bit of an undercount. Some of those reasons specifically is that we do have a really vast geographic area. We have some densely wooded areas as well that we know we have people living unsheltered, residing in. And we do have a large working homeless population as well. So some of the experiences that we heard from our outreach teams this year is that spots where they know there are people experiencing homelessness and living unsheltered, people were not around during the day when surveys were being completed. So they weren't able to do surveys. And a lot of that is due to having working populations as well. And part of that too is why we also think that we may have not been able to represent families as well, because surveys are mostly being conducted during the day. And if parents are not disclosing that they have children, children aren't around, and it might not even get brought up because it's just a one-on-one conversation happening. And so part of having kids in school, you may not be able to see that the person you are talking to is actually a parent. And so that kind of leads us to knowing that we have areas that have undercount. But why we also think that this is more accurate than any year before is because of our street outreach teams. They did a really great job of coordinating amongst one another, ensuring that specific areas always had people counting, that there weren't overlaps in those areas. So we ensured that there wouldn't be any duplication of surveys. And really just the increase of street outreach staff led to us having a much more accurate count than before. We've seen a big increase with COVO's outreach, the Deschutes County host team. Their team has grown exponentially at this point compared to last year. And we didn't have waves of COVID take out entire outreach teams like we did last year. So all of those things kind of impact this year's count of why we believe that it is the closest picture to being accurate as we've ever had before, still acknowledging that there are still areas that are undercounted. And so the question always poses of like, how do we get better data if the point in time count doesn't always lead to the most accurate data? And part of that is having more partners be entering real-time quality data within our HMIS system. Is how we generate our quality by name list, which does keep track of everybody experiencing homelessness, and knowing them by name, knowing what those needs look like, and expanding of our outreach efforts as well. So by having one central place where we can actually access data is how we are going to be able to ensure that we have quality data that is representative of the Tri-County area. And that question too about the point in time count always leads us to how do we end homelessness? How do we have these numbers go down instead of always going up? And so part of that is our region is working through something that is called reaching functional zero. So being able to have homelessness be rare, brief, and non-reoccurring. So when we have families or individuals experiencing homelessness, having a response system that is able to quickly move people back into housing that is stable and safe. And part of that is the work that we are currently doing of expanding shelter capacity, expanding permanent housing opportunities, different key stakeholders who are helping to develop more affordable housing. When we increase our availability of housing, we will have more options to get people quickly rehoused. But like everybody in our area is acutely aware of, we don't have a lot of availability of housing, nor do we have affordable housing. So that makes it really difficult to be able to move people out of the system instead of having people kind of languish within the homeless response system, whether that is a shelter or an unsheltered situation. Some of the ways that we do measure our impact is through something that is called the System Performance Measures, which is an annual report that we submit to HUD. And that allows us to track our first-time homeless, how long people are experiencing homelessness, what the percentage of successful placements of housing is, and that retention of housing. It allows us to track how many people are going into a house situation and yet returning back to homelessness within a period of time, whether that's within the first 6 months all the way through 24 months of being housed. And so some of our different community needs are some of the things that we currently have in place that we just kind of need more of to be able to serve the population that we have. So right now we do have the Lighthouse Navigation Center, but being able to provide more navigation centers throughout the region would allow us to be able to serve people more effectively. So these are some of our continuum priorities and projects that we are working on of bringing additional funding and access to. And some of them have already been in the works, like our permanent supportive housing. We have Cleveland Commons coming online and currently in the beginning stages of being built. But it will only be 30 units and it is designated, which is great instead of scattered site. But for permanent supportive housing, you do have to be chronically homeless to qualify for it. And so we saw that we had 300 people experiencing chronic homelessness who would probably be best served through something like a permanent supportive housing opportunity, where we just simply don't have enough PSH opportunities at the moment, even with some coming down the pipeline. So those are some of the big needs that we have of our community and some priorities that we are pushing for. And really anybody in our community can help engage with this work of helping advocate for more services in our area. So some of the things that can help end homelessness would be having a large variety of housing solutions and tiered stepped approaches. One size does not fit all. And so we know that we need a variety of services that are as unique as each person experiencing homelessness is. And so having help advocate at a city and county level for additional houseless services, expanding of safe parking, that is also one of the big solutions that we see, and that can be helped for a tiered approach. Having additional transitional housing and tiny villages, additional low barrier shelter and shelter alternatives for people who are experiencing homelessness. We haven't been able to finalize the housing inventory count, which looks at the percentage of utilization to available beds yet, but we will be finalizing that in the next week. But for the majority of our shelters on the night of the pit, they were mostly at capacity. So we have a lot of community members that really do not have any other option but to stay in an unsheltered situation. So being able to advocate for things like safe parking, tiny villages, different shelter options, to being able to expand that, as well as more affordable housing in the region, are ways that anybody within our community can help. The COC and other service providers make homelessness rare, brief, and non-reoccurring. So that is the end of my slides. I'm going to take a second to just look at some chat messages because I haven't yet. Let's see. I want to just open it up.
I'd just like to thank all the work that went into this. I know in past years, it's been a real struggle to get this information out in a timely manner. And I think this is the best report and the quickest report we've had for a while. So thank you.
Yeah, thank you, James. I just want to also say a huge thank you to all of the outreach workers that are really the ones that are on the front line of collecting all this information. They do the work day in and day out, and it's oftentimes a thankless job. And so I really just want to emphasize that and acknowledge all of their work that doesn't always get highlighted. Awesome. And if there are any other questions, please reach out to us at info@cohomeless.org. Let's see, it is .org. I will throw this in the chat as well for anybody. So if there are any additional questions that get brought up or any other data elements that you were like, oh, I'm kind of curious about that, please reach out to us via email and we can try to break down anything else as well. And then we will be getting this recording and then the slides posted to the HLC site tomorrow. So thank you so much, everyone, for attending and just being here and all of your support. Awesome. Have a great day, everyone.